political analyst Mr. Obina Oduche emphasized that the government is not interested in the citizens. Rather, the focus is more on collecting from the citizens while calling for decentralization of the powers of the federal government.
It's a laughable situation that federal government is planning to increase the salaries of ministers, governors, presidency, and the elected people in offices without recourse to our health system. So we don't have hospitals, let alone workers in those hospitals. The doctors left in Nigeria are those ones that couldn't afford to finance themselves to go outside the shores of Nigeria where they work and they are recognized and they are well paid. That's one thing. Every country, the health sector and education sector is number one. But in Nigeria, they are the least. Nobody talks about them. The first priority of every government is safety. And health counts 90% of safety when you talk about the safety of the citizens. The drugs are very expensive. So every aspect part of our health system has failed. The doctors are not well paid, yes. When they go on strike, many people die. People in the hospital, nobody takes care of them. The poor people attend public hospitals. They cannot afford private hospitals.
Seriously.
So these are the issues. Our government doesn't, their scale of preference is number one, getting more money from the citizens, taxing them more and more, taking whatever that the poor citizens have, and put in their pocket. That's what the government is interested in. They are not interested in taking care of the citizens, which is life, security and life of the citizens supposed to be number one priority of the government. It's a rocket science. The way out is to decentralize the powers of the federal government. That's the way out. Just make governors to stay away from any blame. When anything comes up, they tell you, oh, it's a federal road. Oh, it's a federal hospital. So they stay away. But when you decentralize and give every state the responsibility to do whatever they want to do in their state and survive, you will see there will be healthy competitions among the states.
Elsewhere, the Nigerian Union of Journalists, NUJ Abia State Council, through its Abia State Chairman, Chidi Asonye, has made a call during the commemoration of National Food is Medicine Day, celebrated on September 14, urging policymakers to prioritize affordable nutrition as a national health strategy, warning that the high cost of foodstuff in the market was worsening the burden of chronic illnesses among Nigerians. Asonye emphasized that the soaring cost of living had made it increasingly difficult for many families to access nutritious meals, stressing that food should not be seen merely as a commodity, but as a critical tool for preventing disease, while he urged governments at all levels to implement sustainable food policies that align with global campaigns linking nutrition to public health. Asonye reiterated that many households are struggling to afford balanced meals, which has resulted in fueling malnutrition and diet-related illnesses, highlighting that policy intervention is no longer optional but a necessity. Furthermore, he observed that Nigerians' food security crisis, coupled with inflation, has placed the country at the risk of diet-related health complications if urgent steps were not taken to control it. The Abia NUJ chairman emphasized that journalists in Abia State have already launched a crusade against hunger, malnutrition, unemployment, and insecurity in the state.